Hi, I'm Brian Barula. This is my video presentation, video 1. This is my introduction for hemodynamics and circulatory shock, and I will be going over the topics as well. So what's on the agenda? The topics I will be discussing for these video presentations will be hypovolemic shock, distributive shock, cardiogenic shock, and obstructive shock, which would be specifically cardiac tamponade. So for the first topic at hand, hypovolemic shock, which refers to a medical or surgical condition in which rapid fluid loss results in multiple organ failure due to inadequate circulating volume and subsequent inadequate perfusion. So this is this is what we see the most from our own patients as respiratory therapists, is that we'll see that VQ mix match, and that's a big example for that. Distributive shock is the second shock that we'll be talking about today. It results from excessive vasodilation and the impaired distribution of blood flow, which is specifically, or one of the examples is septic shock. It is the most common form of distributive shock, and it is characterized by considerable mortality, which means that it is very deadly. Cardiogenic shock is a decreased cardiac output and evidence of tissue hypoxia in the presence of adequate intravascular volume. So this is basically just that perfusion that we're not seeing most of, and it can cause tissue hypoxia or lack of oxygen towards the body's tissues. And for lastly is the obstructive shock, which would be a cardiac tamponade as one of our examples that we'll be talking about today. It is a clinical syndrome, and it is characterized by the accumulation of fluid in the pericardial space, or between that layer of the fluid of the lungs and heart, that space in between, resulting in a reduction of ventricular filling and subsequent hemodynamic compromise. So it's going to put a lot of pressure on those great vessels, which will then cause a number of untold circumstances, VQ mismatching, not enough perfusion for the tissues, resulting in tissue death or hypoxia, and so on and so forth.